Hello, this is Katherine Marie, and you are listening to Long COVID Real Talk podcast. Today we have a special guest, Angela Rudolph. Let me explain a little bit of the background here. I was listening to the Long COVID Hour, and they had a specific BIPOC episode, which stands for Black, Indigenous, People of Color. I say that because I had to look it up. And she spoke so eloquently and I was just really touched by what she said. And I wanted to have her on the show, and she graciously responded to me reaching out over Twitter or X and is here today. So thank you for being here. I really, really appreciate it. And I know it'll be really enriching to everybody listening.
That is so kind of you. Thank you so much, Catherine. I appreciate that introduction.
So the first question that I usually ask is, what was your life like before COVID?
What was my life like before COVID? Pretty normal, I guess. I was a single person, pretty, to be honest, career focused, super overachiever, if I am honest, type A personality. My friends and family would probably say that I was probably overly focused on work and getting things done. So I worked super hard, lots of extra hours, and, always feeling like I had to really kind of give 1,000% in all ways at all times. And, I had worked for the city of Chicago as deputy commissioner during the height of the pandemic. So I was actually one of the folks to work through the pandemic. I wasn't at home learning how to do sourdough. I used to laugh with my friends who would send me pictures about all the different things that they were doing. And I will admit I was a little jealous because I was still going into the office and doing all the stuff. I had zero, commute time because there was nothing and nobody on the streets. And, I had a very different kind of pandemic experience than everybody else because I was considered essential worker. And so, for me, it was weird because I was super afraid about catching COVID during the pandemic because I was still out and about. I'm an only child. My mom and I share a space. We live in a duplex. She is an elderly person. She has congestive heart failure, lots of health issues. And to be quite frank, I was actually pretty terrified about bringing something back home to her because I was out and about. So I was super careful during the pandemic as a result of that. And so in the middle of the pandemic, I was in a really small pod. I wasn't going around anybody. I wasn't doing anything. And it got to be pretty intense, as you could imagine. She got sick at one point and we thought she had COVID. I literally had to drop her off at the hospital and I couldn't go in with her. It turned out that wasn't what was going on, but it was a moment for me where I decided I couldn't work at the city anymore. And I decided I was going to go do something else. And I went back to working in philanthropy, which was a field I had worked in previously, because I thought it would be safer and it would be easier. And so I could work from home and it'd be grand. It would be wonderful. And little did I know that didn't mean it would be safer, because when I came back home, that was when I got COVID. I ended up catching or contracting COVID on a women's empowerment retreat of all things. I had worked at the city. I had been doing all this stuff and running all of these programs. I was quite frankly tired, almost burnt out. And so, my job was oh, there's this women empowerment retreat. You should go do it. It was in San Diego. It was wonderful. Beforehand, we had to get PCR tested. It was outside. We were supposedly testing in the morning before you went to sessions. You could mask if you wanted to. I had been masking all the time. but this was the first time I didn't mask around people because I thought I was safe.
Right.
And I had a grand time. It was wonderful. It was the first time that I felt like I was able to rest. And I came back home. This was the first week of September. I was still testing when I came back home because I wanted to make sure I kept my mom safe. And on August the 31st, 2022, I remember the date. I tested myself in the morning just for, safety's sake. And I tested positive for COVID. And I was just like, oh my God, how do you get through the entirety of the pandemic? And you go to a women's empowerment retreat, and that's when you get COVID. And that was the beginning of, what became this incredible journey for me of this upending event. I got sick and I never got better. I have asthma, have had it for much of my life, but it was the sort of thing that was always controlled. I never really felt any problems from it unless it was under certain circumstances around mold, high instances of mold. It was really cold or dust instances where like around exercise, like I had exercise induced asthma. Like it was really limited moments when my asthma would kick in. It was almost a joke that, I would make for people. It just never really happened. And so for me, even though I was high risk, I didn't really feel like I was. I was also pre-diabetic, but I was highly controlled. But the month of September 2022, I could not catch my breath. Like I was always short of breath. I even the act of talking, I was short of breath. I had a cough that wouldn't go away. I had chest pains. I got put on, I had a cough that wouldn't stop, a little bit of a fever, light. I was bothered by light. Like I couldn't be in a bright room. I wasn't able to eat or keep anything down, or in. Kept working. That was the other piece of it too, which was the dumbest thing ever. Kept working because I felt like I had to, because we had a big meeting at the end of the month that I had to be prepared for, and I didn't feel like I could miss it. So I was working every day, even though I felt like complete and total crap. And my doctor put me on prednisone. So I was pretty much on prednisone every day of the month of September, which also after a while started making me feel mentally unstable. I felt like I wasn't myself. I started getting super depressed. I remember one day I was sweeping something up off the floor of my mom's house, and I knocked over the dustpan. And the act of knocking over the dustpan made me cry. And I thought to myself, why are you crying? It's the dustpan. Like, why is that is something to make you be upset? And I was like, oh my God, you need to get off of prednisone because this is not a normal reaction. And I remember thinking to myself, if I stay on this medication much longer, I'm actually a little afraid about what I might do to myself. So it was just one of those things where it was an out of body experience, right? And as the month went on, more and more, I felt like there was something going on and there was something wrong with me. And my doctors were kind of like, oh, we'll just keep waiting to see what's going on and see if you get better. And I should pause and say, I already knew about what long COVID was. I had been, I'm blanking on the doctor's name. He's out of Duke, West Wiley, I think is his name. I had been following him on TikTok of all places. And he had been talking about long COVID on TikTok because he had already been heavily involved with those kinds of patients. And he had been warning people on TikTok about not getting COVID because you didn't want to get COVID because COVID could lead to this thing that doctors had been following and had already named long COVID. So I was already like, oh my God, I don't want that. So that was one reason why I was really strict with this regimen of I cannot get COVID because I don't want to get this thing that they're talking about called long COVID. So in the back of my mind, because I had stayed sick for so long, I was thinking, holy crap, do I have long COVID? Because you should not be sick with these same symptoms for going on a month. So we got to the end of the month. We got to my board meeting. That was the meeting for work that I had been working at forever. And I am presenting in the meeting. I can literally barely talk above a whisper. I can barely walk. I'm super tired. And I struggle through the meeting. I go back to my office. I burst into tears. I'm calling my doctor because I'm terrified because I'm like, something is seriously wrong with me and I don't know what's going on. My boss comes into the room and I say to her, I can't do this anymore. I can't work anymore. I think the reason why I'm sick is because I keep working. So I need to stop working. And she's like, okay, let's figure something out. And I said, good, because this cannot stay. And I go see my doctor. And that's the first time my primary is saying that this might be long COVID. My primary, who I've been with for 20 plus years, is also getting ready to leave. So I'm being transitioned to a new doctor. So my current doctor is like, yeah, this might be long COVID. Your new doctor, who I'm going to, let her know about what's going on. We're also going to have you go see an allergist who is going to start monitoring your asthma more closely and, all this other stuff. And we're going to see if we can figure things out. We're going to give you one more dose of prednisone. And I'm like, this is the last course of prednisone I'm going to take. I'm not taking this anymore because this is literally not good for me mentally. They're like, okay, fine. We promise this is the last one. And then I make arrangements with my job to max out my vacation and sick time to take the month of October off. And I do that. And while I am out the month of October, my extended family steps up to help around my house. And one of my cousins comes over. He brings his two kids with him to do some work in our yard. And his youngest daughter, he has two twins, a boy and a girl. The girl is a little sick that day that he comes over. And I remember my mom and I were like, weird. She's kind of sick. I don't know. And I say to my mom, don't come around her because she's sick, because I don't want you catching anything. Like me, I'm just laying on the couch and she just stays around me all day long. And I don't think anything of it. I mean, hell, I'm already sick. I'm thinking it's no big deal. Maybe the following week, I start with this cough, but I'm like the same stuff that I've always had. And I noticed that my mom has this cough too. And I remember asking her, hey, how long have you had that cough? And she's like, oh no, it's just started the last couple of days. And I was like, we should test you to make sure it's not COVID. And she's like, okay. I test her. Her test comes back negative. And as I'm looking at her test, I'm like, so weird. Your cough started the last couple of days too. Maybe I should test myself. So I test myself again. And my test comes back positive. And I'm like, that's odd. I literally just had COVID. You're not supposed to be able to get COVID so quickly because they say you have this immunity or whatever for so many months. And I'm like, that's probably a mistake. It's probably because, this long COVID thing. And I'm just like, that's so bizarre. But all night long, it's really bugging me that I just tested positive for COVID. So the next morning I called my doctor and I'm like, hey, something really weird just happened. I took a test for COVID last night and it came back positive. And I think that's so weird. And they're just like, wait a minute. You took a COVID test last night? And I was like, yeah. And I said, it came back positive, but I'm assuming they're like, no, no, no. If you took a COVID test last night and it came back positive, that means you have COVID. And I was like, no, that's not supposed to happen. And they're like, the over-the-counter COVID tests are going to pick up live COVID virus that you have now. And they're like, there are enough COVID strains around right now that you very much could have COVID again. And I'm like, that's not what you guys said on TV. You said I'm not supposed to get COVID again. And they're like, no, you need to get to a urgent care right away. And I'm just like, what the entire hell? I have been lied to. You all said you could not catch COVID. And they're like, yeah, no, you just caught a different strain. Yeah, I caught COVID twice in about a 45 or less than a 45-day period. My mother, I retested her again when I called her and said, hey, I do have COVID. We should retest you again. She had it too. So we both now go to urgent care. I should preface and say, when I had COVID the first time, it was at this weird period of time when they weren't giving Paxlovid. It was only being given to seniors.
Mm-hmm.
But the second time I got it, they were like Oprah Winfrey, you get Paxlovid and you get Paxlovid. So the second time I got it, I did get Paxlovid. And so both my mom and I, came together and we had Paxlovid together. And so I literally slept the entire month of October. I picked up new symptoms though. The second time I had COVID, I picked up migraines. I didn't have it the first time, but the second time I picked up a migraine all day, every day. And so I had migraine headaches in October all the way until I started taking meds for it in January of the following year, 2023. I also started having really bad gastrointestinal problems. I could not like eat anything. It was weird. I don't know what was going on, and they couldn't figure out what was happening with me in that regard. And then I also started having issues with my heart where I started having racing heart rate, where I would notice that my heart rate would get higher if I would walk or stand. And so this book, The Long COVID Survivor Guide,
I have that too.
yes, exactly. It had just come out right when I got sick. So it literally became a Bible for me. And I feel super fortunate compared to a bunch of people who obviously had gotten sick beforehand, that I had something to read, a community to go to. I had something to be able to guide me in conversations with doctors. So I knew about POTS, right? So I already knew that POTS was something that a high number of folks who had long COVID were dealing with. So when the issue with my heart was happening, I had a suspicion that I potentially had POTS. So by now, my new primary care doctor was on the docket. And so I reached out to her and I'm like, hey, there's something going on with my heart. And she's like, well, what do you mean? And I'm like, yeah, it's really, going high and fast. I can feel it. And she's like, well, what exactly are you talking about? And I said, I can tell that my heart rate is really going high. And so she was like, well, sometimes we're just really aware of our heart rate. And I was just like, no, I'm sorry. I think here, let me be clearer on what I'm talking about. Because by this time, I had data, right? I said, my Apple Watch is telling me that my heart rate is out of control. And I was like, in fact, when I wake up in the morning, it's telling me, hey, while you were sleeping, your heart rate was like 120 or 130. That's not supposed to happen while you're sleeping. So that's a hard and fast data point that there's clearly something going on. And she was like, let's see, why don't you monitor it for a little while longer? And I was like, lady, what the, are you, are you serious? So I was like, hey. So she wanted me to monitor my heart rate and my blood pressure and send it to her. So I'm doing it on a daily basis, a couple times a day, and I send it to her. And I send it to her and she's like, this seems to be normal. What? Are you batty? This is not normal. No, madam. I am not a doctor, but I know that this is not normal. And so we went back and forth like this for a couple of months. And she really was starting to get annoyed with me. Like, why do you keep talking to me about this? And so finally she's like, fine, I will order you a Holter monitor. And so she gives me a Holter and they put it on me. And so I'm wearing this Holter monitor for, I want to say it was 5 days or whatever. And, it gets sent in. And I remember I turned to my mom and I was like, if those results come back and this lady reaches out to me and she says, everything is normal, I swear for God, I am going to cuss her out. And sure enough, she reaches out to me and she goes, good news, your results came back. Your heart rate is normal. And I'm like, madam, we did not get the Holter monitor to talk about my heart rate or my heart in terms of whether or not my ticker was normal. We were trying to determine if my pulse was elevated. Let me ask you a couple of questions. Was my pulse elevated? Well, yes, it was. Okay. Is there not a high propensity for people with long COVID to have POTS? Well, yes, there is. So, yes, there is a high propensity for people with long COVID to have POTS. And if right now it shows that my heart rate is elevated, does it not make sense for you to refer me, as I have requested from you multiple times, for me to see a cardiologist who has a specialty in POTS so we can determine whether or not I have POTS? Well, if that's what you want. Yes, that is what I want. She goes, here's your referral. Here's my referral. You're not going to call? She's like, no, you can call for yourself. Fine. Whatever. So I called the cardiologist. And so the woman who's doing the intake, she's like, okay, so I see you have a referral. I was like, yeah. She's like, so are you short of breath? Well, yes, I am. Do you feel like your heart rate is elevated? Well, yes, I do. And so she's asking me all of these questions and she's like, okay, I'm sorry. I can't make an appointment for you. You need to go to urgent care because it sounds like you're having a heart attack. And I was like, oh, no, no, no. See, wait, no, see, that's my normal feeling. I have long COVID. And one of the reasons why I'm trying to get the appointment is because I think I have POTS. And she's like, that's fine, but your referral wasn't put in that way. it was just a general referral. See, if that was the case, then your doctor should have called in herself as opposed to you calling in. Because since you're the person calling in, I can only take your referral in this way. And because she put it in this way, and because I'm required to ask you these questions, I can only refer you to urgent care because it sounds like you are having a heart attack. So I have to call the doctor back again, and she's like, and your doctor knows this. So I'm like, so now you're telling me that she is ucking around with me and she really just doesn't care. So I call her back and I'm like, hey, the people have said that you are the one who need to call and set this up because otherwise it sounds like I'm having a heart attack, which, by the way, I told you there was something serious going on with me. In order for me to get this appointment, you have to be the person to really help set this up because otherwise I am not going to be able to get the appointment that I need to be able to see the doctor that I need to see. And so she begrudgingly sets everything up. But the fact that I had to literally pull teeth with her really angered me to the point where I was like, I need to find a new primary care doctor because A, you've never reached out and checked in with me one time that I have had this long COVID diagnosis. I'm always reaching out to you, asking you to set things up, reaching out and getting you to do things with you. When I had my previous primary care doctor, she would regularly follow up. How are things going? What's happening? This woman never checked in on me. Long COVID is a very serious chronic illness. And I recognize that doctors right now feel very much like, I don't know what to do with this. Okay, fine. But we can be partners in figuring this out. But instead, what ended up happening for me is that I became my own doctor. I was the person always trying to figure out what was going on, who I needed to see, diagnosing myself, directing people for what was happening with me, who I needed to see, what the course of actions should be. Had almost zero help other than a couple of really cool specialists. But the role of the primary care doctor, which would have been really nice, was missing for me in this scenario. And that part for me was really crappy throughout this entire process, quite frankly, which is one reason why I ended up looking for another doctor. And to be quite frankly, I looked for a primary care doctor of color because one of the things that research has shown is that people of color, particularly Black people, have better outcomes when your doctor is Black or minimally a doctor of color. And time again, for me, the vast majority of time, that has always turned out to be a true case. That's a long story to show kind of how my journey for care has kind of shaken out.
I remember when I listened to the long COVID hour, you had not had a new PCP at that point, but you have now. Okay.
Yeah.
So it was over a year
primary
ago.
care now. Mm-hmm.
And how is it going with that one?
Great. So sadly, it took over a year for me to be able to get in to see a new primary care doctor. One, because a lot of doctors ended up leaving after COVID. So the pool of available primary care doctors out there has shrunk considerably. I also found out I am not alone. And so obviously the pool of doctors of color, particularly Black doctors, are incredibly small. Black people are often looking for Black doctors. And so it's hard to get in to be able to find Black doctors who are open to taking on new patients. And so when I was able to find a new doctor, she's a Black woman, I had to wait over a year before I could get an appointment with her for the first time. I love her. She's amazing. It was well worth the wait, but I definitely had to take a lot of patience in order to be able to get to that point to be able to see her.
It was an awful experience with your PCP. I can't
It
imagine.
was. I agree. It was definitely.
She made it worse for you. Not only did she not help, she made it created more hoops for you to go through.
She did. She did. And I ended up leaning on the specialist, which was frankly a weird and surprising scenario to be in. So the allergist that I had, she was a lovely Indian woman. She did a lot of work that she didn't need to do. I remember, so this is an example of what I'm talking about. I tried getting into the long COVID clinic so I'm in Chicago. So Northwestern has a long COVID clinic. The University of Chicago has a long COVID clinic. Both of them were incredibly difficult to get into. I am not ashamed to say that I ended up going through a friend to get into the long COVID clinic at the University of Chicago. Part of that was because there was over a year wait in order to get into the long COVID clinic at Northwestern. And one of the things that ended up happening, as you know, when you do go through the long COVID clinics, is they run you through a battery of tests to try and figure out what's going on. So I did a pulmonary test at U of C where they try to figure out what's going on. My doctor at Northwestern, the allergist who also monitors my asthma, has to see the results from the University of Chicago. The woman reaches out to me at like 8:00 at night to say, hey, I looked at your results from U of C, and I don't think that your breathing issue is a result of your asthma. I think your issue is cardiac. And she's like, even though everything is coming back normal, if you look at, even the normal ranges, there's a little piece of your test that makes me believe that's what's going on with you is based off of something that is based off of a cardiac response. And I think that that's what you should pursue to figure out why you're short of breath. So you didn't have to do that. But that was the sort of thing that, really kind of put her above and beyond what you don't normally see from lots of doctors, unfortunately, in the field. And she and I had a conversation about this. And, God bless her. Bijou Malde. I love that woman to death. And one of the things that she shared was, and I'm going to show a little grace here too. One of the things she shared is that, doctors right now feel overwhelmed because the insurance systems require them to see a ton of patients really quickly, and they're not able to have that kind of personable interaction, particularly as doctors are younger. They're not trained in that way anymore. She also shared that, to be able to do that kind of engagement, it means that you're working harder and extra time. And she's like, for me, I'm giving a lot of myself, and I'm sometimes driving myself crazy to do those sorts of things. And I'm going to acknowledge that because she's calling me at 8:00 at night to give me that bit of information. And so it's a catch-22, right? Because these are systemic barriers that are keeping our doctors from being able to provide us the kind of care that particularly chronically ill folks like us need in a moment like this. And so it's really difficult for folks like us who really require more from people in the medical system who are working with a disease that requires them to give more in a system that is asking people to give less, I guess is what I'm thinking of. And so everybody is losing out right now. Unfortunately, particularly folks of color, in my opinion, are losing out the most. And so for me, I felt like I was always fighting and trying to work and figure out what was it I needed to be able to do, to have, to get, to be able to get better. I also had aphasia at that time too, like a lot of cognitive issues came up for me. I am way better now than I was. Then by the end of October, I could not pull words down. Like having a conversation for me was very difficult. And that was really hard for me as a woman who prided herself on feeling like I was a fairly eloquent speaker. Professionally, I did policy and advocacy work. I worked as a lobbyist, being able to go out and speak to people, to speak on behalf of communities of color, people who were underserved. All of those things were things that I felt really passionately about. And COVID took that from me because I was no longer able to think quickly and clearly. I could barely get words sometimes out. When I went back to work, it was initially challenging for me because of both the fatigue and also because it took me longer to work and to get through what I had to get through in terms of my work activities. I got a work accommodation to be able to continue to work from home. And by then, my job was everybody was still working remotely. But part of what I asked for was flexible hours so that I could rest as needed, but also work longer because I knew that it would take me longer to do things. And my work was fine with that. And then I was also still going to see different doctors to figure out how I could get better. And then I got a really great neurologist at the University of Chicago who suggested I get into the long COVID clinic at the Shirley Ryan Ability Lab, which was a godsend. Took me, I think, maybe 4 or 5 months to get into it. But by the time I did cognitive and physical therapy with them. And what they ended up helping me do was to relearn how to walk because I was utilizing a cane by then, because I had finally been formally diagnosed with both POTS, but I'd also been formally diagnosed with having a heart condition. The COVID had damaged my heart. I have heart blockages in the small vessels of my heart as a result of COVID. So my asthma doctor was correct in terms of my shortness of breath was based off of cardiac issues. So Shirley Ryan retaught me how to be able to walk and how to be able to pace myself and how to be able to rethink and rework cognitively how I thought and how I was able to engage and kind of find my voice and be able to kind of speak and do lots of things that I had lost. I had to go into therapy because there was fair amount of guilt that I was carrying around because I blamed myself for being sick, um, because I was upset with myself for not adhering to all of the procedures that I had done before. Like, I went to this conference, I didn't mask up, I didn't do all the things. I went to the zoo and I got in a cab with the cab driver and I was in there and I didn't put I had all of these things that I had spent all of this time thinking about I didn't do. And that was why I got COVID. I had a hard time with rest because I was always someone on the go. I was always doing things. I had a hard time taking naps, as it turned out. And so I just had to really work through lots of things in my head. And I basically had to kill off the idea of who Angela was before and make room for who I was going forward. And I also had to get comfortable with the idea of being a disabled person. That was a big part of what I had to work through in therapy. Comfort with disability and working through my own issues of ableism, quite frankly. It's hard enough in this world being a Black woman, but being a Black disabled woman, I was like, do I really need to add another thing on top of that? But it was one of those things that I had to not only be comfortable with, but to embrace. And I've gotten more comfortable with it and I have embraced it. And I see it as a really important part of who I am as a person in the world, as a really important part of my inner self and my inner being going forward, and a voice about a community that I'm a part of and I want to speak for and, advocate for and with as well, because there's a lot that I think we can learn about, generally speaking, in the long COVID world. I'm greatly bothered by the fact that when we talk about long COVID, it rarely involves people who look like me, even though so many folks of color were touched by COVID. But yet when you look at the issue of long COVID, a lot of the research barely looks at or talks about folks of color. That to me is a huge disconnect. Seems weird to me that that's something that is not automatically discussed or even talked about by the community. That we're not finding people, that we're not talking about the fact that the medical community is not raising this voice within communities of color. The vast majority of folks of color don't know or understand about long COVID. I end up inadvertently becoming an educator about this chronic illness with people. And I also end up becoming someone who encourages people to go talk to their own physicians about their addressed illnesses that people are often ignoring because they don't know that they potentially have long COVID, because often folks of color feel like they just need to push through how they feel because we as a community believe that we often have to just push through how we feel because we're not allowed to be tired, because we have to contend with so much. And I think that there are too many of us who are suffering in silence with long COVID because we're not doing enough to help people of color who don't understand or know what they're dealing with right now.
I think on the episode that I heard you speak on before, I think someone had mentioned also that the Black, Indigenous, and people of color communities are it's like they're almost expected to be tired or something.
Mm-hmm.
Like it's not waving any red flags to the providers or whatever because mm, they're expected to just be tired because they work hard and that's just how
Hey,
it is.
that's just how it is. Exactly. I mean, I had never heard of POTS before until I got it. The vast majority, I think, of people who are often diagnosed with POTS are typically white women. That seems weird and odd to me.
Right here.
Right, exactly. And so it's one of those things where it's like the typical, symptoms that people have are things that, if you present to doctors saying that you're tired, what they will automatically talk to you about is diabetes. That is the go-to, disease diagnosis that they'll talk to you about. But they won't look to long COVID. They won't look to POTS. They won't look to, ask you questions like, well, how many times have you had COVID in the last couple of years? That is, to me, a really big indicator as to whether or not you might have long COVID or you might have POTS or, you might have ME/CFS or any of the other, kinds of related, diseases that are kind of linked to all of the different syndromes that are kind of ancillary to it. Like those are questions that typically folks of color are not often asked when they are in a doctor's office, but they will definitely ask you about whether or not you are diabetic or pre-diabetic, whether or not you have high blood pressure. And I get that. I understand why those are questions that you would ask. But given the fact that COVID has become a mass disabling event, those should also be the other questions that people should be asking as well, and that you should be looking for as well.
Yeah, especially because the BIPOC communities were hit so hard with COVID that it would
Yes,
make sense that they would also be hit very hard with long COVID, just percent
absolutely.
wise, you know?
Yeah, definitely, definitely. And I know when I go to long COVID clinics or when I go to other places, I don't see people who look like me. And that too also is a very weird disconnect.
I can't imagine. I agree with you. When I go, I don't see anybody else.
Hmm.
Well, how do you feel like having long COVID has changed your life? Bes- it- having to, besides having to kind of mentally say that the previous Angela is dead and this is the new, post-pandemic long COVID Angela.
Yeah.
How how do you do that?
Yeah. Well, one of the most immediate ways that it changed my life is I lost my job. So despite my employer initially being supportive of me, that support waned over time. My accommodation over time began to be clawed back. So I was required to come into the office more and more. And then eventually, because of that and other reasons, I was let go at the end of July. And so, yeah, I am currently unemployed and on unemployment. And that is a huge change to me and, impact to my life and, the life of my mom. I am her primary caregiver. She's my dependent. And so right now I am in the midst of relaunching my consulting practice because I think it's probably better for me to do consulting work than for me to try and do full-time work. But that is a big impact on my life as a result of COVID. It makes it difficult from an employment perspective in terms of what does work look like. Had a full, vibrant career prior to getting sick, and now I've had to completely rethink what does my professional life look like prior to being sick, and had to rearrange, what does professional Angela look like and how does she move through the world? So there's that. For me, my life is different in that I used to travel a lot. I never thought anything about kind of hopping on a plane and going somewhere. I love to travel throughout the world, and now I have to be a lot more deliberate about doing those sorts of things. I still love traveling. There was a time that I thought I couldn't, and now I know that I can, but I just have to be more thoughtful about how I do it. It tires me out. It's not just the trip itself, it's the going and the coming back. Travel days are brutal. They take a lot out of me. I have to rest up before the trip. I have to rest up once I get there. I have to rest up after I get back home from the trip. And so all of that, takes a lot of planning beforehand. So, that part of it is different for me. I have to be thoughtful about what the future is going to look like for me long term in terms of health outcomes. I never really thought about. Like I have shared before, I had what I thought were, some health issues, but they were controllable. And now I would say there's a lot more question marks that I'm not fully aware of what the future holds. There's lots of research that shows that there could be a potential link between long COVID and dementia. That already runs in my family. And so it's something that I keep an eye on, and I kind of wonder about what lies in my future. And so, that's something that I think about. What do I need to be prepared for in terms of what the future looks like for me? So that piece of it is something that I keep in mind. But then, I would say the other piece of it in terms of how it's changed my life is that I try to be more present. And I also try to think more about living life that is a lot more focused on being content and happy. I would say in the past, I used to always focus on thinking on, what I didn't have or what wasn't right or things didn't go the way that I wanted. Whereas now I try to just focus on things are good enough. And that's okay, because it has shown me life is short and that things come at you fast, right? I think the biggest lesson I learned from what happened is things are mad unpredictable. I would have never, ever predicted that I would become disabled. And that was the biggest thing that I couldn't wrap my mind around when I first got sick. How did this happen to me? That was so hard for me to wrap my head around. I remember at first I was like, a couple of days ago, I was fine. Am I just sick now? That was just so hard for me to really wrap my head around. And I think that's the part that people don't quite understand about disability and about how it can happen to anybody. And the fact that I was reading recently that 90% of disabled people weren't born disabled, that it can just happen to you. You're just going about your life and then you can just become disabled. And so it's the sort of thing that people need to understand that disability is the sort of thing that people move in and out of throughout different parts of their life, right? Because long COVID is like that too. I've known people who've had long COVID and they've gotten better. I know people who have long COVID and they continue to struggle with it. And so it's one of those things that you just don't know, right? And so that brings me to this idea of you really need to kind of live in the moment of understanding that time is fleeting, happiness is fleeting, all of these things you need to like really soak up as they come to you. And that is a lesson of COVID that I would have never imagined, that I am quite thankful for. Like, I am thankful for the time that I have with my mom and understanding that, you know, the time I have with her, the moments I have with her, recognizing that, you know, the ability to love on her, to take care of her, despite the health challenges that we both have, is a blessing. Losing my job in July, even though that has been scary and challenging, it has still allowed me to spend quality time with my mom. That's a hidden blessing, right? So you really do have to search for moments, even in those times that feel really, really dark and really, really sad. Because that's really the only thing that really helps you to get through.
The last couple of questions are kind of related, and you kind of already answered them, but in case you have any other thoughts on them. First is, are there any tips or tricks that you've come up with over the course of navigating long COVID that you wanted to share? And also, are there any take-home pearls that you wanted to share with other long haulers besides the ones you
Yeah. Well, I mean, I would say find community. When I first got sick, I felt super, super lonely. And when I was able to find other folks who had been through or were going through what I was going through, it made everything feel even just a little bit better. So finding community either online, there are like Facebook groups out there, finding people on Twitter, I refuse to call it X, you know, who are out there as a way to kind of find community who can share, you know, tips or places you can go, is a good way to kind of help you to navigate. I shared the long COVID survival guide. I know sometimes it is really difficult to be able to read. So if you're not able to read, there are also podcasts. There are a ton of podcasts. Obviously, you know, Catherine's is one to be able to listen to. There are other podcasts that I utilized as ways to understand this illness. I mean, for me, that's one way that my mind worked. I literally threw myself into any and everything that I could to be able to understand this illness, to understand what remedies were out there or how this illness worked. Because unfortunately, the truth of the matter is the medical field still does not understand what long COVID is. The vast majority of your primary care doctors out there do not understand what long COVID is. And a lot of the time, you will have to become your own best advocate. You'll have to be the smarter person in the room. You will sometimes have to be the director of your medical care. And when you come in the room having that authority, doctors pay deeper and closer attention to you if you can give that information to them in an authoritative way, and being able to kind of explain or direct or tell them things causes them to listen to you in a new and a different way. And that's something that I learned, frankly, the hard way. The other thing that I would share is pacing. That is so much the truth. I literally have on a board in my office, it says feel good, question mark, think about it. I got that one from my cognitive therapist, and she, told me to put it up because she's right. Those days you feel good, think about it, because feeling good will often cause you to overdo. I also suffer from post-exertional malaise. When I do too much, and then I pay for it on other days. And so pacing really is your friend when you really do want to kind of make sure you're not doing yourself a disservice by doing more than you should. I used to do visible. I stopped doing it. And this is just for me. Part of why I stopped using the Visible app was because I found myself thinking too much about my illness. I got up every morning thinking about long COVID. I was like doing the breathing and this, keeping track of what I was doing with the apps and everything. And it was consuming every moment of every day for me. And I stopped doing the apps and everything because I wanted to take a step back from constant monitoring of all of the data of my life. But that didn't mean I wasn't keeping track of how I was living my life. And so everybody needs to find what is the best way for you to be able to kind of do the thing that helps you to be your best self. And so there's the Visible apps, there are all of the different things that you can utilize. And so I would say figure out what works for you and utilize that thing to help you to be your best self. Spoons, pacing, all of the things, are the ways that you might be able to do that. And at the end of the day, listen to your body, because to me, that's the number one thing that will tell you what you need to do, because I can always tell when I'm doing too much. Start to get this fuzzy feeling in my head, start to feel too tired. My migraine starts to creep up a little bit. And then I'm like, ooh, I need to go take a nap. And then I just go do that. So for me, those are like the little pearls of wisdom that I would share.
Thank you for all of
Yeah.
that.
Thanks, Katherine.
Thank you also for all the spoons that you spent just telling us all of these things. It takes a lot of energy, and I wish you the best nap ever after this.
Very much. It's
So,
nice talking to you.
thank you. Thank you too. And we'll talk again real soon. Thank you everyone for listening. Okay. Take care. Bye.